Bande Dhanantari Tamu Nikhila Gadavana Praudha Davagilnilam. Friends, I am really humbled and honored for the professional honor that my society and all of you have given. To begin with, I thank you all for being here. That's why I am here. To hold this position, the president of the society, my predecessors have worked very hard, and today I stand on their shoulders, and I thank all of you for bestowing your trust in me. And in any presidential oration, it is a privilege to give public homage, particularly those who have been responsible for your journey. To me, my most profound indebtedness is to the institute I belong. My parents, I don't have praise high enough for them. And my most enduring acknowledgement, as always, has to go to Dr. Mala, my wife, who has been the anchor and has given stability for whatever journey I am going through. Our children, one is Lydia, she is here, and Vedant. They have been very, very understanding and supportive. My teachers, I will not be naming all of them, particularly in spine surgery sphere when I started. Dr. V. Hemlata, she is the one who initiated me into spine surgery. The most important, Professor Sastry is here. He forced me to go into the laboratory, do experiment. His initial work of spinal ischemia and spinal injury, I used to accompany him to the lab, spend late in the night, till late in the night. Sir, I think you will remember the dates. Then to the modern spine surgery. I accidentally met Dr. Patrick Kluger, and he initiated me, he introduced me to the modern spine surgery way back in 1994. He gave me a set of instruments also, how to work free of cost. I brought them to India. These are the teachers you won't understand unless you work them. You won't learn their warmth, their kindness from the books. Lastly, today I am here by the influence of Professor Ramani. I feel spine is personality, and 225 million years ago, during the Cambrian explosion, spine evolved, and it has grown to this stage. Friends, our conference is replete with best scientific presentations. I probably will not be equate the kind of papers that our pioneering scientists are presenting. So I thought I'll divert a little bit from the scientific thing, but talk something else. If you think of medicine, medicine has evolved with tradition, faith, superstition, and slowly with modern concept. It has changed over time. So I thought we can go back a little bit towards the ancient things, what our past people have done. Because those things what in past the doctors or the people who are involved in medical practice, they might have been erroneous when you look at them today. But you can't close eyes. Maybe that is the foundation on which we have built up our present day. So I think this is the best occasion for me to pray our gratitude for the ancient doctors who have brought us this far. If you watch carefully, most of the scientific things that have taken medical field has taken place, it is around the Mediterranean Sea and then down to India. The roots have gone back to the pre-Aryan period, and you will find this was written even before the Vedic period. The Indians believed that spine is, all the chakras are there, and the main center, Merudanda in Sanskrit means the central axis, the central pillar of the universe. So Man is supposed to be the center of the universe, and the Merudanda is the center of the universe. So all the power is there. That's why you see everybody, every yoga, every other people try to focus on the spine, make it stronger. Any Indian or any culture, everything revolves around spine. Be it with dance, be it music, it revolves around the spine. And the strength of power, they say, this is a mythological picture. When there's a fight between the celestial beings and the demons, they have to get the spine of Dadhichi to make Indra's most powerful weapon to fight against the Vritra, some name I forgot, but with the demons. So that was the concept. Friends, spinal surgery basically started in India. The sage Vyasa, who authored Mahabharata, in great detail he describes how Krishna, during his wandering, came across the lady with hunchback and cured. It is not a miracle that he did. He knew the science. It is in great detail it has been described in Sanskrit, how exactly he did this. In India, as I told you, we thought of Dhanvantari, as is the picture I said. Dhanvantari was not a heavenly body. Basically, in India we say, rice is God, water is God. Anybody who benefits us, we treat him like God. God is a sentence or language. Bhagavan, Pitrudeva, Father is God. Same thing, anybody from whom we benefit. Dhanvantari was a human being who did good job, good surgery, good medicine for the people. Though he treated as God. Then we put 4 hands. This is to say, like we talk of Ganesha, a common man, layman cannot understand what is the power of an individual. They say he had the power of 100 lions. Or Ma Durga, we saw the picture, had 8 hands. She has the power of as much as a people with 8 hands. That's what to explain the common people. So things goes. So one of the golden age in Indian history is the Sushruta, the great surgeon. He is the first to introduce cadaveric surgery, residency program, medical license, and ethics and oaths. So Sushruta did anatomical dissection. In Indian Hindu tenet, human body is divine. A dead body is divine, that belief. So they do prayers and then they discuss dissection. The concept dissection came first in this country. Sushruta also knew how to treat spinal injuries, and here great detail it has been described how to reduce a spinal dislocation. He also had this fracture bed. After that, almost 500 years before the Edwin Smith papyrus thing happened, you had the code of Hamurabi. Doctors were afraid to deviate from the tradition what was going on. They had punishment. A hand should be cut. There are 9 codes prescribed for the medical people. So they were basically scared to do anything drastically and deviate from the basic things. Then came the oldest written literature that is available for us, the Edwin Smith papyrus, where it is written that an ailment not to be treated. During this Egyptian period, possibly they never did surgery, but definitely they have made very good observations about the human body. Came to the Grecian period, Hippocrates. He described the sciatica syndrome, back pain, and fracture leading to paralysis, and injury of one same side leads to paralysis of same side. See the beautiful observations thousands of years ago. Then his beds, Hippocratic bed, the way of reducing the spinal injury. And those days they were giving this honey and flesh for the open wounds. Herophilus and Erasistratus, the butchers, they are called the butchers because they did vivisection. And lot of data came with that. You see the Erasistratus. Now, one of the most important person in that time is Celsus. He is the one who observed cervical spine fracture, there will be vomiting, there could be difficulty in breathing. Injury to the lower part of the spine can lead to paralysis of the legs, urinary retention. Even today, many of our young students do not know, but they could make that observation thousands of years. Came the Roman period. Most important person at that time was Galen, who ruled for 15 years. Whatever Galen said, people accepted. And he is the one who said, pus is good for, it's good. That's why the word came, laudable pus. Friends, and that's the treatment for scoliosis, deformity, which even today you find in some places. So we cannot just ignore what they did. Even today also people are doing in remote places this kind of treatment. Came 7th century, Paul Agena. He the one who basically summarized whatever work has been done, and he put in record. He wrote 7 books, volumes. So that is the time, he is the one who did laminotomy and removal of bone fragment. After that came the Middle Age, when Europe became down, the Arabs dominated. This is the time when the book by Avicenna came by Canon Medicine. Basically, it's the Galen's concept which was reinforced. And this is the time when whole of Arab medicine flourished. It's practically the same thing what Galen had propagated, what Hippocrates has propagated, continued. You will see the pictures which I have taken, not much difference, but people have tried to improvise and improve over the ages. In the 13th century, in Italy, Theodoric of Bologna is the one, first of all, pus hindered proper wound healing. He promoted antiseptic method of surgery. He also thought of splinting. He was vilified. He became the controversial picture because he challenged Galen. Whatever has been done so far, for 1500 years, he is the first to challenge. But then it took years, another 500, until Lister came forward and said, no, this is right. Friends, see the great Da Vinci. He could give the accurate image of the spine, the tilt, the curve. He have done 500 anatomical pictures. So, must have done proper research, dissection, and then reproduce the picture. It took another 1500 years practically to do a laminotomy after Paul of Agena, 7th century and 1829. Successfully, patient became okay. People started believing. Friends, the beginning of 20th century, tuberculosis ruled, so people started doing debridement and treat for tuberculosis. The birth of spine surgery was given in 1916 by no other than Charles Ellsberg. He did surgery for the spinal cord, AVM, he wrote the book. This is the time spinal surgery became a new branch. It got established that spine surgery should be a new branch. Slowly, things have progressed. During the last century, the other person was Claude. He is another person by whom I was influenced into spine surgery. I had the opportunity to see him, to assist him when he visited when I was a resident. Things are changing, friends. The birth of spine surgery, then the orthopedic surgeon will do, or neurosurgeon will do spine surgery. When I was a resident, we used to call the orthopedic surgeon colleagues. In the year 1994, because there are a lot of cases going on against the implantation, so we came together. We came to that, we must work together. That's how the spine surgery has improved, flourished. Change is the only constant in the universe. See 1990, 1890, and the Neanderthal person. Are you going back from where you started? No, but the earth is round. So we have to look back what our ancestors have done, and which we must learn from their experience, not to make those mistakes. Friends, it is really the best time to be a spine surgeon because the technology has advanced. We cannot say medicine is not exact science, but the future medicine has to be exact science, precision. So we must put our best endeavor to be the perfectionist. We cannot take excuses. No, ऐसे हो सकता है, ऐसा नहीं. This can happen, that can happen. So please, we must see the future that we have to be perfect surgeons. And our decision should be perfect and to be precise. Thank you all.
Thank you, Dr. PRUSTY.